Now coming to odontogenic pain, we generally either give paracetamol, ibuprofen, or aspirin. However, as I mentioned in the earlier video, that we don't give any ibuprofen or aspirin to asthmatic patients or any patients on warfarin because it can make it worse. So we give paracetamol instead. Generally, however, it is preferred that we give ibuprofen because it has an anti-inflammatory action, which paracetamol doesn't. In this exam, they're probably, if it comes in the OSCE part, they will tell you which medication sometimes. So even unless they specifically say, if they say pain relief, you can mention either. But if they specifically say ibuprofen or aspirin or paracetamol, just mention those. And they may even tell you, so this is the number of days that's given in the guidelines. However, they may tell you themselves how many days they want you to give the medication for. So in that case, ignore the guideline but go with what they're asking in the question. Now, paracetamol, ibuprofen, aspirin, one thing that they have in common is that they're all given 4 times a day, and secondly, generally our treatment regimen is for 5 days. The difference is that paracetamol is given as 500 milligrams and 2 tablets. Again, 4 times a day for 5 days, and ibuprofen is given as 400 milligrams, 1 tablet 4 times a day for 5 days. Aspirin is the dispersible kind that we prescribe, and it's given as 300 milligrams, 2 tablets 4 times a day, again for 5 days. Trigeminal neuralgia, I'm not sure if this has come in the exam, but I've heard from people that it may have come in the DTP, the trigeminal neuralgia. So for that, we give carbamazepine 100 milligrams, 1 tablet twice a day for 10 days. Now ulceration. Now if it's just general ulceration that's happened once, if there's one ulcer, we can just give the patient a mouthwash. Now this can be, as I mentioned earlier, the chlorhexidine mouthwash, which was 0.2%, or the hydrogen peroxide mouthwash, which was 6%. However, if the patient has recurrent aphthous stomatitis, and it's basically the treatment isn't just responding to the mouthwashes that you've given, in that case we can give doxycycline dispersible tablet, and that's given as 100 milligrams. We give 1 tablet and dissolve it in water. We ask the patient to rinse their mouth for 2 minutes and 4 times a day for 3 days. We give the patient 48 tablets. In this case, we're giving a lot more because it's recurrent aphthous stomatitis, so the patient will have recurring episodes. So it's better to just give them the tablets in one go and just explain to them how to use them rather than give them the tablet each time. Lastly, coming to local analgesics, benzidamine mouthwash can be given as 0.15%. 300 ml is given, just like in chlorhexidine hydrogen peroxide. We rinse the mouth with 15 ml every 1.5 hours. Now you can look up the guidelines for how to give benzidamine spray, lidocaine gel, or lidocaine spray, but I feel like this should be sufficient information along with the previous videos to cover the exam. If you have any questions or have any comments, just comment below. Thank you.